much for inviting me along this afternoon. It looks like you've had a fantastic program all day, so let the journey continue. So yes, I did some research in sexual experience in older age. So I'm going to present some of the case studies from that research. One of the things that people told me about when I started my research a few years ago was that nobody would talk to you about, older people wouldn't talk to you about sexuality. They don't talk about those sorts of things. And I have to tell you that I had to close my books. I interviewed too many people, and I had people who were wanting to discuss their sexuality, and I wasn't able to accommodate all of the numbers of people. So it was a fantastic response in that regard, and broke down some barriers, really. So how many people here have a first aid certificate or have done some first aid? Quite a few of you. Okay. Well, you'll remember that one of the things that you had to do, first of all, you had to make sure there was no danger before you approached a person who might have collapsed or might have had a problem with them. Do you remember that? And then you had to assess their response. So one of the things that you did by doing that was to say, whoops, let's see, can you hear me? Can you hear me? Did you call that out? Do you remember that? Can you hear me? Open your eyes. Do you remember that one? Open your eyes. What's your name? Okay. Well, that was if they did open their eyes, then you had to call out, what's your name? And then finally, squeeze my hand. Squeeze my hand. Okay. And when I thought about that, I was thinking, because I had to update my first aid certificate not too long ago, and I thought, that just reminds me of my research about the sexual experience in older age. Doesn't that remind you of that? Okay. Okay. So because when I was doing my research, I found that, can you hear me? Nobody was listening to the idea that older people might be sexually active. Nobody was listening. Have you found that yourself? Okay. Open your eyes. Look around. Look at people who are healthy in older age and active. You know, especially one of the problems that the research picked up was that GPs particularly don't like to communicate or feel uncomfortable talking about sex with their patients. Anyone found that? Okay. So open your eyes. What's in a name? We don't talk about sex, sexual intercourse, do we? We say being intimate, making love, having a relationship. So we need to talk about it. We need to talk about it, what it is. Sexual intercourse, penile penetration, all of those words. And that's the thing, we don't tend to talk about it. Squeeze my heart, okay? Instead of squeeze my hand. We have to realise that older people have hearts that still can be squeezed. Don't you agree? Okay, so that's where I thought about that. Okay, so when I was doing the research, one of the things that came from the literature was the components of sexual desire. And the three main components are biological drive, psychological motivation, and also the social and cultural influences that impact on us. So, for example, we're often afraid to do what our neighbours might think, oh, that's the wrong thing to do. For example, if we're embarking on a new relationship, we don't want people to know about it, do we? We're very influenced by social conditioning. Okay, do you agree? Yeah. Okay. Okay, so when I had a look at the literature for my study, and more recently again I updated it, it tends to fall into those three components of sexual desire. So you'll find that literature around this area will look at the biological function, you know, how functional people are, quantitative, they'll do some studies about how frequent people are having sex, all about embodiment, and of course I wrote about the biomedicalisation of sex myself. And healthy ageing. One of the things that I found out from my research was that healthy ageing, we hear a lot about, in order to be sexually active, you need to be healthy, or in order to be healthy, keep active sexually. And I found that wasn't quite correct from my research, because I had people in my study who were in very poor health and remained sexually active, and alternatively I had people who were in quite good health and for various reasons no longer was sexually active. So the two didn't always go hand in hand, as there's this presumption about that. In relation to the psychological literature that you can find, there's all about the psychological motivation, being motivated to have sex, having a sexual identity, being identified as a sexual being. All about self-esteem and intimacy as well. That was the flavour of the psychological-based literature. And then the socio-cultural. And as I said, we're often conditioned by, in our age group, the older age particularly, are often conditioned by society. But one of the big things from the socio-cultural literature was the problem of partner availability, and that is a big problem for a lot of older people. Okay, sexual risk-taking. I have a case study that identifies that as an issue. And also communicating with health practitioners. Two of the authors there, Hinchcliffe and Gott, who are GPs, they write a lot about the problems, the uncomfortableness that a lot of GPs find with talking about sex with their patients. And my research showed that older people would talk about it with their GPs, but they're afraid to initiate that conversation. So we need to encourage GPs to start the conversation, particularly where a person's been bereaved or is starting a new relationship and may have some sexual health issues. One of the things that came out of the research and from the literature review was that a lot of older people haven't had sex education. They didn't have it, wasn't available in those days. So a lot of people don't know a lot about sexual health and protection and those sorts of things. So this is another area. Okay, so my research, as I said, I interviewed too many people, and it was a great experience. In fact, when I was doing the research, I said to a colleague, I don't mind if I don't finish the study or get an outcome. I'm just enjoying doing the research. So it was good fun. But the narratives altogether were universal, and they were also unique. One of the things that the strong theme that came out was the fact that it doesn't matter whether people are sexually active or not, they still experience, I'm talking about the people in my study, so obviously I can't generalise, but they would still experience sexual desire, however fleetingly. People that hadn't been sexually active for years, I'd say every now and then, yes, I think back and I think, yes, it was good. I would love to have a man or to have a lady in my life. And so that experience of sexual desire never really goes away, or didn't go away for the people in my study. But it was unique too, the theme, in that everyone, of course, is an individual and has their own experiences and their own narrative. The themes that came through from the research was about quest for a new relationship. So there was hope for the future in that regard. Betrayal. One of the gentlemen in my study, he was in his mid-70s and he was in a new relationship, or a relatively new relationship, and he came home one day and he found his partner on the floor with another man, and so he had immense feelings of rejection and betrayal, and he discussed those in his interviews. Not seeking a relationship. Some people have accepted that they. I can think of a couple of men in my study who had had prostate cancer, and they had a big problem with erectile dysfunction, and so they were no longer sexually active in that regard. And that's the other thing. I mean, if we think about sexual activity, we tend to think of it in what we call normo-heterosexual concept, whereas there has to be a man and there has to be a woman, and you have to put the two together, but with a penis in between. And it doesn't always work out that way. There's a lot of different ways of engaging in sexual activity without necessarily having sexual intercourse. But sometimes acceptance of that was one of the themes that came through. Living the gay life, that was about identity. Now, 3 different men in my study all came along and said to me, "You won't believe this, but I was married, and I've been married for 50 years, and my wife died, and now I can identify myself as a homosexual." But this is where I talk about the social conditioning, the cultural conditioning that we have in the days when he was married. That's what was expected of him. He was expected to get married and have children. And it wasn't until years and years later, and now it's become more acceptable in society, and of course after his wife had died, that these 3 different men were able to acknowledge their homosexuality. love and compromise. We talked about the themes that came through about compromising and being aware of the other's needs. And that's what selfhood is all about, being an individual and being aware of your own needs and compromising on behalf of your partner. And then one of the things that, a strong theme that came through for those men that did have problems with erectile dysfunction was that one of the men described that as the experience of nothingness, being in a nothing place. He said it was like being in a chopped off place, and that was how he described that. So it was quite devastating for him. So altogether, the research findings were about identity, being identified as a sexual being, and all of the people in my study, whether or not they were sexually active, did identify as a sexual being. As I said, they would say that they did have fleeting memories of sexual desire and occasionally reflected back to those. The concept of selfhood, being an individual and caring about meeting your own needs and meeting other people's needs, your partner's needs as well. And of course the ethical dimensions of the sexual relationship in terms of how we treat our partner, how we treat each other. So those were the strong themes. So let's have a look at a case study, and if you recall, you'll see that you'll know that the title of my talk today was Sexual Experience to Have or to Put on Hold. And here's Oliver. He was an 80-year-old gentleman, and he wasn't about putting it on hold. He'd been happily married for 50 years, and throughout that time, they'd have enjoyed a wonderful sexual relationship. And eventually, though, his wife got ill, and also Oliver had the experience of prostate cancer himself, and he became unable to sustain an erection. So with both of them moving into poor health, they decided to try clitoral stimulation. So Oliver and his wife engaged in that as a form of sexual activity. And Oliver said that he got enormous pleasure out of seeing his wife having orgasms through the clitoral stimulation. One of the other things that they had done throughout their married life was that he had always trimmed her pubic hairs. It was just one of those things people do in intimate relationships. And nearing the end of her life, she said to him, would you cut my hair one more time? Would you cut my hair? And he said he looked at her and she was so frail. He just couldn't bring himself to do that, couldn't bring himself. And of course, just to go back a bit, sometimes when they did that in the past, throughout their relationship, it may or may not have led, more often than not, it did lead into more active sexual engagement, but not always. So he was, when she said, can you cut my hair, he just couldn't bring himself to it. Then she died a few days later, and he said one of the things that he most regrets is that she was reaching out for him to touch her one more time, and he just wasn't able to do it. And he really regretted that he hadn't done that. So it was one of the things that he regretted. Okay. So Marilyn. Now Marilyn was an interesting lady. She was a lady, there was no holding back with her. She was 75, she was beautiful. I won't go, you can read that up there. And she was a lady who had married late. She married when she was in her 30s, never been married, never been in a relationship before. She hadn't ever been with a man. And they were happily married for 30 years. And then her husband died. And after he died, she got busy with the garden, revamped the garden, renovated the house. And after 3 years, you know, she was bored with all of that and she was lonely. So one of her children said, Mum, why don't you put an ad in the paper for a companion? So she did that. And she was inundated. She had 6 responses. She had more than 6 responses, but soon she had 6 men in her life. One of them she went to the pictures with every week, and they had a platonic relationship. With the other 5, she was sexually engaged, and she said she made notations on her calendar. And I said to her, "How do you remember their names?" And she said, "Oh, darling, I just call them all darling." And the other thing that she did, she was very flamboyant, and she wore big hats and scarves and sunglasses. So if she ever went out with them on outings, she said she was always well disguised. So that was another thing that she did. So yeah, and then she had one relationship, and she said to him, "You see, I'm 75," and she said to this fellow, "Would you like my legs above your shoulders?" And he said, "Oh, I've never done that before." She said, "Oh, come on." So in recent years, though, Marilyn has been touched by dementia, early dementia, and so she's but she certainly has lived her life to the full in no regret, so no holding back. She said, I enjoy my life. She had a fantastic marriage for 30 years and she used to get very lonely, but she doesn't now. So it's a lovely story there with her. I wouldn't recommend it. One of the things that my research also picked up was the rising incidence of sexually transmitted infections. And again, I think that relates back to the idea that a lot of older people didn't have sex education and aren't aware of some of the risks in that regard. Harry was 70 and he had been married for quite a long time before his wife died. She died very suddenly after a very routine procedure, and then a short while later he formed a new relationship. And it was a bit slow sexually to get off the ground. They went out together for 6 months or so before they became sexually active. But eventually they did, and he said in the early part of their sexual relationship, it was every night there for a while, and he described himself as having a high level of sexual desire. But anyway, he said, and that's what he said, that when the big desire that happens when you're younger, where it completely dominates for a time, where you just want to do it. I wouldn't say it changed a lot over time, even as you got older. I would say that sexual desire or enjoyment, if he doesn't think it declined. He said it's always there with him. Okay, but what happened then, he himself had a procedure, a very simple procedure, in fact an angiogram, and somehow or other it caused nerve damage to his erectile function, or not to his erectile function, sorry, to his sexual function. He was able to sustain an erection, but he couldn't have an orgasm, and that was very frustrating for him. Anyway, but after a few years, his second wife developed Alzheimer's disease, and that was another issue for him because one of the outcomes of dementia, not always, but can be I can't say the word. She became very disinhibited and demanding of sex where she hadn't been before. And that was a new experience for him. But the problem there was that he said with her dementia, he didn't feel as if he could make love to her because it was like making love to a child. So it goes back to that ethical treatment of the other and how we guide our life in that regard. So that was a problem. Eventually, he cared for her as long as he could, and eventually she had to go into residential aged care. But and then he met another lady, and this lady that he said, I'm in love with her, he said, but she doesn't want to live with him, and she wants to retain her independence. And she's quite demanding, so he still has that problem of not being able to achieve an orgasm, and the new partner only wants penetration. So, but he said she's not given up on him, so they'll continue, and hopefully their relationship will smooth out. Okay, and then finally Jennifer. Jennifer is about putting it on hold. Jennifer had been married quite young and twice divorced. And then after the second divorce, she had a succession of failed relationships. But after her second marriage, just to go back a bit, she bought herself a new bed, and she identified this bed as being very important to her because it was her bed, and she wasn't going to let anybody else in it except on a short-term basis. So in these new relationships that she had, she wouldn't let the men stay overnight. But anyway, after the last failed relationship, she went along on her own for a while. And then she got a bit lonely, so she got onto the internet, and she met a man who lived in another state, and she arranged to go and meet him for the weekend to stay with him. So she flew off holus bolus. It wasn't close, another capital city. It was quite a distant one, and she went across the country and she spent the weekend with this man she'd never seen before. Didn't know anything about protection for sex when I asked her. So not only could she have been bashed or robbed or anything, but she could have also acquired a sexually transmitted infection. Fortunately, she didn't. But this is the sort of risky behaviour some people do because of their loneliness. And but in the end, she said the weekend was okay, but they just didn't have the chemistry, so they didn't. They gave each other. They said goodbye at the airport, and that was the end of it. And then shortly after that, she said her granddaughter gave her a shoulder massager because she'd had some arthritis in the shoulder. And she said she soon found a new use for that shoulder massage. And she said It gives her the best orgasm she's ever had. And she said, the beauty of it is, if she dies and they find it, nobody will think anything of it. So, one of the things, though, she has said is that she does miss the smell of a man occasionally. She does, but she said she has much better orgasms with this shoulder massager. So she's carrying on. So that's Jennifer. But again, that reiterates that that risky behaviour that some people are undertaking. Okay. All right. So. Oh, that's right. That's what she said. I said, aren't you worried about acquiring a sexually transmitted infection? She said, oh, by the time it became a problem, I'd be dead anyway. So that was her attitude. Okay. All right. So back to my research. So those were 4 of the case studies out of my 36 I could have told you about. Quite interesting stories. Of course, everyone has an interesting story. We're all so unique, aren't we? But what I found from the research was that we are sexual beings for our entire life, whether or not we're sexually active. So age, I found, wasn't a factor at all. Health, sometimes poor health would refocus. If you were in poor health, obviously sex wasn't a priority and you would focus on your health. But as I said, some of the people in my study have been quite unwell and still able to maintain some sexual activity. Sexual desire, if you're not psychologically motivated, then oftentimes some stimuli, like touch or even a song, a favourite song from your youth, will stimulate that desire. And a few people in the study did report that had happened to them. Age, as I said, wasn't a factor. People were aware of slowing down, but age didn't come into it as far as being sexually active or not. Remember that we're very adaptive as human beings, and it's no different with our sexual life as well. We become adaptive. One gentleman whose wife was quite demanding, she had a high desire, and she was on a CPAP machine, and they had to sleep in separate beds, but she would invite him to the bed. So he adapted to her. They adapted as a couple to her condition. So we're very adaptive. There's a lack of a partner. That's a problem. Okay, I'm getting the rush now. And that affects the ability to fulfil sexual desire, but not the desire itself. How many minutes have I got? Okay. Oh, okay. All right. And as I said before, social norms do influence us. We do worry sometimes. Some people worry about what the neighbours think. But I found that in older age, the older you get, the less worried about that you are. Maybe it's a sense of time running out, I'm not quite sure. So, but the people who were in the older age group of my study said that didn't worry them at all. Social norms, and there's a lot of confusion around biomedical interventions, and that's why I wrote the article, and particularly about communication with GPs and with partners. So some of them, one of the men in my study said, well, he went off to the GP because he wanted to have Viagra, because he had some erectile dysfunction. So the GP wrote out the script and said, there you are. And of course, when he went home, his wife was on the verge of going away for a few days. So there he was with this erection for 3 hours. And he couldn't do anything about it. So there needs to be communication between the GP, particularly between the two partners, but also with the GP as well, okay? All right. So I won't go into all the study, but the findings from the study on biomedicalisation of sex were that overall they were very disappointing. You know, people, the men in the study particularly said that, you know, there were a lot of, well, here's what people said. The feeling is there, he said, but it doesn't seem to activate anymore. So this is a fellow Grant. He tried, and this gentleman was in a threesome. He was in a threesome. He was 84, and the lady in the threesome was married to somebody else. So people are having very adventurous lives out there in relation to sexual activity. And the bottom one, if you have a look at the bottom one, James, he said he wasted a lot of money and he tried everything, tried all of it, injection, pump, everything, patches. But he said, don't spend it until you prove it. Overall, he found it was quite disappointing. So where are we in terms of having or putting it on hold? Okay, so we need to move from that cows to care. We need to have a conversation with our partner if we have a partner. We certainly need to have a conversation with our health practitioners, and particularly if you're starting a new relationship. Okay, adapt to your circumstances. We can be very creative. Sexual intercourse is not the only option. There are a lot of ways you can be satisfied sexually without necessarily having sexual intercourse. Just to go back to that first one, don't forget the GPs might need prompting if you want to talk to them. Remember to think about safe sex, especially if you're engaging in a new relationship. It's really important. And encourage discussion amongst your peers. Now, I had a gentleman in my study who was 92. He'd been married for 60 years, but he was recently, he'd been widowed. And he was a very refined, old-world gentleman, lovely gentleman. And he said he went to a dinner party, and he was there, and they were all talking, and he's very mischievous, had a very mischievous twinkle in his eye. And he said, I waited for a gap in conversation, then I said, "What do you think about masturbation?" And he said, "You could have heard a pin drop." There was absolute silence. And then, after a short silence, everybody just resumed talking about what they'd been talking about before. They didn't want to discuss it. So talk to your peers, encourage that discussion. You know, that's what's important. So we're moving from cows to care. All right. All righty. I don't know if I've finished soon or have I finished too soon? All right. Thank you.